Imagine millions of doctors suddenly left without paychecks, all because of a political standoff in Washington. That's the shocking reality facing physicians right now. As the government shutdown continues, Medicare payments to doctors have been put on hold, leaving healthcare professionals in a precarious position. But here's the kicker. Once Congress gets its act together and renews the necessary healthcare programs, most of these claims should be honored. Stick around, because this isn't just about money. It's about how politics can disrupt the very fabric of patient care. Daniel Payne delves into the intricate dance between the health industry and Washington politics. He came to STAT in 2025 after reporting on healthcare for Politico. Feel free to contact Daniel via Signal at danielp.100. Tara Bano focuses on the world of hospitals, providers, and insurers. You can reach her on Signal at tarabano.70. At the heart of this issue is the Centers for Medicare and Medicaid Services, CMS, which has halted Medicare reimbursements to physicians. This announcement popped up on their official website, https:/www.cms.gov/medicare/fee-for-service providers, but there's no timeline for when the payments might resume. The root cause. Congress must reauthorize specific Medicare payment programs, especially those supporting telehealth services and care in rural areas. Unfortunately, these renewals have become entangled in the broader negotiations to end the government shutdown and get federal operations back online. To help beginners grasp this, let's break it down. Medicare is a federal program that provides health insurance to millions of older adults and people with disabilities in the U.S. It covers everything from doctor visits to hospital stays. Telehealth, for instance, allows patients to consult doctors remotely via video calls. Super handy for those in remote areas who might otherwise struggle to see a specialist. Rural providers often serve communities with limited access to medical facilities, ensuring that folks in small towns get the care they need. Pausing payments for these programs makes sense in a way, but why halt all physician payments? It's puzzling, and CMS hasn't provided immediate clarification despite requests for comment. But here's where it gets controversial. Is this pause a necessary evil to force congressional action? Or is it unfairly punishing doctors who are already on the front lines battling pandemic aftershocks and staffing shortages? Some might argue that cherry-picking which payments to suspend could have prevented widespread disruption, potentially protecting vulnerable patients who rely on timely medical care. And this is the part most people miss. These delays could ripple out, causing doctors to postpone treatments or even close practices, especially in underserved areas. For example, picture a family physician in a rural town who depends on Medicare reimbursements. Without them, they might cut back on hours, leaving patients to drive hours for care. This article is exclusive to Stat Plus subscribers. Already have an account? Log in, https:// Unlock this article, plus daily market-moving biopharma analysis, by subscribing to Stat Plus. Already have an account? Log in, https://www.statnews.com/login. View all plans.statplus. To read the rest of this story, subscribe to Stat Plus, https://statnews.com/statplus. Daniel Payne reports on how the health industry and Washington influence and impact each other. He joined STAT in 2025 after covering healthcare at Politico. You can reach Daniel on Signal at danielp.100. Hospitals and insurance reporter, A.B. Tara Bano, covers hospitals, providers, and insurers. You can reach Tara on Signal at tarabano.70. What are your thoughts on this? Do you believe the government should prioritize funding for healthcare programs over other shutdown negotiations? Or is there a valid reason for bundling them together? Is this pause a fair tactic, or does it unfairly burden hardworking doctors and patients? Share your opinions in the comments below. We'd love to hear differing viewpoints and spark a conversation.